accidentally being detected lah. Yeah. So our aim is actually 0 case of category 2 and 3. Next one, please. Right, okay, let us go to the incident of wrong surgery. Yeah, if we go by discipline, we can see here that the most common ones are actually orthopedic and also ophthalmology, followed by neurosurgery and general surgery. Yeah, and we also had a few cases in neurosurgery, breast and endocrine, as well as ONG lah. Yeah. This is actually the statistic that we receive through our Malaysian Patient Safety Goal System, meaning it includes a private sector as well. Yeah. Next one, please. So in terms of the type of error, we can see that the most is actually wrong side lah. Yeah. Okay, 20 cases. Next one, please. Right. Okay, this is the case that I would like to share. The first case, yeah, I name it the Swiss cheese model, yeah, and the case is about 59 years old patient with bilateral knee osteoarthritis and planned for right arthroscopic partial meniscectomy, and then the patient was sent to OT without site marking, and the team didn't check the consent properly prior to the surgery. And the whiteboard also did not mention site of surgery. Yeah, and the team was also not attentive during the timeout session. I think a previous speaker has emphasized the importance of timeout. Whereby this is the final time where you have the moment to do the final checking before you do skin incision. So this is very, very important to make sure that the patient is right and the surgery is right and the site is right as well. Yeah. So finally, the surgeon mistakenly done the surgery on the left knee instead of the intended right knee. Yeah. Okay, next one, please. Right. This is what I mean by the Swiss cheese model. When we talk about Swiss cheese model in accident or incident in accident or incident, we can see that there are multiple failure in the system. So one is no site marking, and then consent was not checked properly. Whiteboard didn't mention the site of surgery, and the team was not attentive during the timeout. Yeah, so basically there are multiple unsafe act and unsafe condition that lead to the incident. Yeah, so wrong surgery. Next one, please. Okay, so why non-compliance to Safe Surgery, Safe Life program? So it's important to do a proper root cause analysis, yeah. And sometimes the root cause analysis can be a little bit complicated. Yeah, this is just an example of a simple one. Yeah, so we need to find out why this non-compliance to the Safe Surgery, Safe Life program happened. Yeah. So because the staff did not understand the importance of the program. And then why? Because the training was conducted but very brief, and not all staff attended the training. Yeah. So why? Because it was not made compulsory by the hospital administrator. Why? Because the administrator overlooked this matter. Yeah, so we must make sure that, at ministry level, we actually came out with a policy with the Director General of Health circular to make sure this is implemented. But we must have someone to check also. That's why we also established the Safe Surgery Steering Committee, not only at ministry level, but also at state level and hospital level, to make sure that it is implemented and it is implemented correctly. Next one, please. Okay, this is case number 2. Yeah. Oh no, it's not mine. Yeah. 65 years old patient called Arzak with left eye cataract was planned for left eye cataract surgery during a cataract camp program. And this was conducted on Saturday. And the surgery was done by a team of surgeons from another hospital. So basically the environment maybe is not that familiar. on that day, the first surgery started late, and therefore surgery for other patient become late as well. Yeah, and finally Arzak got operated at about 6 p.m. And the team was rushing to complete the case as the OT supposed to finish by 5 p.m. Yeah. And the operation was done in a shared OT, basically 2 cases at a time. And then no proper whiteboard for the second case. And the SOP on safe surgery was not properly adhered to. No proper checking on patient identification for the lens, intraocular lens, before handling it over to the surgeon. And only after the surgery was completed, the staff realized the patient ended up with another patient's lens. Yeah? Fortunately, the lens power is still within an acceptable range. Yeah. Okay. So this is what happened. Yeah. Okay. I just would like to highlight to you the one that I colored in pink are actually the unsafe condition and unsafe act that actually finally lead to that error. Yeah. So basically kalau kita tengok dekat sini ada 30 patient ramai yang register. Lepas tu Arzak pun case yang second last, jadi BP surgeon pun dah letih kan, daripada pagi sampai pukul 6 baru dah banyak apa ni, dah berapa jam lah mereka bertugas. And then the operation done by surgical team from another hospital, jadi mungkin tak familiar dengan situation kat situ. And then first case pun dah delay, so lagilah lambat. And then 2 case mereka buat dalam satu OT, and then not enough whiteboard. Yang lagi satu tu just use a small whiteboard, and then the surgeon actually rushed to complete the surgery because they supposed to finish by 5 p.m. Yeah, and then the checklist was not filled in properly. Yeah, and then the lens for the day were put in the same tray. Yeah, and then patient identification was not checked properly. Yeah, according to the power. Yeah. Before handling it to the surgeon. Yeah, and also the team didn't confirm the lens belong to patient Arzak. And finally, another person lens was inserted to the Arzak patient. Yeah, and then and they only realized after the surgeon for the last case realized that the lens for his patient was not there. Yeah, so it was lucky like that. The lens actually can be used by that Arzak patient. Yeah. So this is what happened. Yeah. Okay, next one, please. Okay, this is another case, right or left. Yeah, tajuk dia. And this one about 70-year-old patient admitted with bilateral knee osteoarthritis and planned for right total knee replacement. Yeah. And then the consent for the right TKR was taken. And then the site marking was done by the surgeon on the right foot. And then they actually gave chlorhexidine bath to the patient, and the site marking, however, faded. Yeah. And then the checklist was filled as right TKR, and site of operation also dah being confirmed by the patient's daughter. Yeah. And then skin preparation on the right knee was not done in the ward. But the staff actually just wrapped the right knee, yeah, with the green towel. Okay, so dia wrap dengan green towel. So hopefully orang dia harap orang yang tahulah yang dia wrap ni lah yang nak dioperate. Yeah, okay. So the OT list pula somehow written as right knee osteoarthritis, but planned for left TKR. And then tak ada siapa pula perasan ada kesilapan dekat sini. Yeah. And then the staff nurse didn't cross-check the OT list with the consent. Yeah. And then dekat OT pula, MA pula bila dia buat skin prep, dia pun tak check consent, and the BHT, dia only look at the OT list. Yeah. Okay, next one. Okay. So the MA prepared the left knee as the right knee was wrapped. Yeah, so dia ingat, okay, yang terbuka itulah yang perlukan surgery. So ni masing-masing assume lain-lain lah. Yeah. Okay, and the house officer had written on the whiteboard as per OT list, left TKR. Yeah. So time out done, but no one noted the mistake. So kalau jadinya macam ni, that means it was not checked properly lah, ya, tak tengok consent semua, ya, betul-betul, ya. And then left knee was operated instead of right knee. And the team only realized the mistake because the implant was not suitable. Ya, sepatutnya untuk implant tu untuk right knee, tapi yang being operated on the left knee. So they actually stopped the surgery and then explain dengan patient and family regarding the issue, and patient tu nasib baik lah, patient and family agreed to proceed with the right knee TKR, and then they proceed lah. Yeah, so this is what happened. Okay, next one please. Okay, just to share some of the pictures lah. Yeah, side marking tu kalau kita tengok nampaklah side marking prior to surgery on the right foot. Yeah. And then bila dah cuci tengok no marking pula, noted intraoperatively. Jadi sepatutnya kalau tengok garis panduan, we need to use the permanent marker lah. Okay, next one please. Okay, and then kita tengok kat sini memang ada lah tulis tu, right knee osteoarthritis dan sebagainya. Okay, admission slip tu. Next one. Okay, dekat kita punya checklist pun ada tulis semua betul, Okay, next one. So dekat documentation betul, consent semua betul, cuma bila kita buat surgery itu salah, Okay, next one. Okay, I just want to show where did we go wrong. So basically yang color pink ni ialah kita punya unsafe act or unsafe condition that lead to the error lah. Normally when error happen, it's not just because of one factor, but actually a series of failure in our system lah. Okay, so chlorhexidine bath given to patient and the side marking faded. Sepatutnya kita guna a permanent marker, and then skin prep on the right knee was not done in the ward. Staff just wrap the right knee with green towel. And then the OT list pula pun silap tulis, dan tak ada siapa pula terperasan. Okay, and then the nurse didn't cross check OT list with the consent. And then ada assume culture di situ, iaitu di mana the OT skin prep was done by the MA, didn't check dengan consent and BHT, dia just look at the OT list saja. Okay, next one. So kalau OT list dah salah, habislah semua salah. Okay. So and then kalau kita tengok sini ada assume, okay, yang mana yang bila dia prepare tu, dia tengok the right knee was wrapped. So dia kata, mestilah left knee yang terbuka ni yang kita nak buat surgery. So dia pun tak confirm dengan siapa-siapa. So that assume culture is very dangerous. We actually need to verify with someone or with another document lah. Okay. So kita tulis tadi dah salah, right knee osteoarthritis, plan for left TKR. I mean, mistake can happen. We are just human. This is very much human factor. And we should not blame the staff. So that's why we need that multiple checking dan verification lah. Okay, kalau ikutkan time out tu dibuat, tapi masih berlaku kesilapan, that means the checking was not done attentively lah. Probably just tulis ataupun main tick-tick saja. So this is what happened lah. Okay, next one please. Okay, this is another case. Okay, I call it 1+1. Okay, in terms of this case, it involves a 8-year-old Malay boy. Ada sebab saya tulis Malay boy dekat situ. At daycare surgery with right assisted hydrocele for right herniatomy. And then patient ni sebenarnya dischedulekan untuk second case, but yang because ada isu dengan yang first case tu, dia pun brought to OT as first case. Unfortunately, consent tak complete, tak ada siapa yang countersign, no witness. So sebenarnya tak boleh buat lah ni sebab all this documentation tak cukup lagi. But somehow it went through, and then the staff nurse yang handle case ni, that was her first day at daycare. Dan dia hantar patient ni dekat OT, and she did not inform OT nurse that the patient supposed to be the second one on the list. since on that particular day, OT list pula not displayed at the airlock. Yeah, because why? Because it was not prepared by the staff. Yeah, because tak ada lack of monitoring. So sometimes kadang-kadang tak ada OT list tu di display dekat airlock area. Yeah. So OT nurse pun accepted the patient without referring to the OT list yang sebenar lah. Yeah. And the houseman wrote on whiteboard the detail of the first case. Yeah, yang tadi tertinggal tadi. So the details is actually for the first case, although this is the second case punya patient. Yeah. So time out session was not done properly. Staff pun not paying attention when the houseman read out the details of the patient on the whiteboard, and the staff also did not realize the importance of time out, and no emphasis on time out by the superiors as well. Yeah. So and then the patient went through the surgery lah, finally, and then the surgeon actually performed right herniotomy and circumcision sahaja. Yeah, actually dia punya plan is actually for herniotomy saja. Yeah, tapi sekali ni dia dapat right herniotomy and circumcision. Okay, next one please. Okay, so kalau kita tengok there are many factors when we conduct a root cause analysis. Yeah, basically ada team and individual factor di sini lah. Yeah, like lack of communication, the critical processes were not done due to lack of checking and monitoring. And kita tak check properly. Yeah, lack of teamwork, everyone was doing their own thing. And then assume culture, lack of safety thinking, non-compliance to the safe surgery program, dari segi management and organizational factor, yeah, election safety and safety culture, and then no leadership on the safe surgery program, ineffective training on the importance of the patient safety dan safe surgery, safe life program, yeah. And then untuk staff-staff baru pun tak ada regular training, yeah. And then tidak ada audit pun, yeah. Okay, next one please. Right, so what happened to that boy? Yeah, fortunately dia orang Islam. Yeah, jadi the parents was okay. Tak apalah, okay kita nak buat herniotomy tapi terbuat circumcision tapi tak apalah sebab dia orang Islam. Yeah, jadi tak ada isu. So we were lucky. Otherwise we can get sued lah because of this. Yeah, because we did a surgery without consent. Yeah, so these are some of the cases that I wanted to share. Actually ada banyak lagi lah, cuma tak sempat lah, masa tu. Okay, so those are examples of wrong surgery cases yang kita dapat. Dan kalau kita tengok isunya adalah sama saja, isu communication, kita tak check betul-betul masa kita buat time out, tak ada verification, communication issue, teamwork, so lebih kurang itulah dia punya perkara tu. Okay, now let us go to incident of unintended. Saya ada beberapa case lah saya nak share. Okay, kalau kita tengok dekat sini, this is the statistic from the Malaysian Patient Safety Goal. We can see that the number being reported, kita dulu panggil unintended foreign body. We can see that it's actually increased lah, from 13 in 2013 up to 70 in 2020. Most likely because many people are more familiar with the patient safety goals reporting system lah. Right. Okay, next one please. Okay, so case study number 5, tajuk dia if only the surgeon listen. So this is about 19 years old gentleman admitted for interlocking nail of right femur, and the surgery went as planned, so tak ada apa-apa issue. And according to the documentation, gauze yang kita guna adalah 20 pieces. And then second count done by the scrub nurse, and then they noticed that gauze ni ada satu lah yang missing. So the scrub nurse and the squelating nurse informed the surgeon, And unfortunately, the surgeon continued to close the surgical site. So dia tak ada pun nak berusaha nak mencari kok ada tertinggal kat dalam tu ke apa ya. But other staff actually cubalah cari dalam all the clinical and general waste bin atau kat bawah-bawah tu kok terjumpa ya. So anyway, the surgeon completed the closure. But the nurses, they are very experienced and dia pun very concerned and dia tak sedap hati lah. So they advised to the surgeon to do II, yeah. And finally, okay lah, surgeon pun setuju. And then they did II and then they actually found the gauze left inside the surgical area tadi lah, yeah. So anyway, so dah jumpa macam tu. Ya tak ya, the head of surgeon was called and then they reopened and then they found the gauze lah. Yeah, so over here we can see clearly lah if we can actually properly search for the gauze yeah, before kita buat we close yeah, then it will be another. I mean, we can prevent that from happening lah. Yeah, retain a surgical item. Next one, please. Right. So another example, yeah, case study 6. Tajuk dia we can't find it. Yeah, it's about 62 years old gentleman previously had total thyroidectomy. And then 2 months later, the patient went through combined surgery lah. So the ENT came in to do a tracheostomy, yeah, because the patient had prolonged ventilation in ICU. And then the plastic team actually came for SSG to the chest wound, and then secondary surgery over abdominal wound debridement to the right foot. Yeah, so ada a few things berlaku di sini. Yeah. And then before closing, the staff noticed the gauze missing also. Yeah, and then visual inspection of the wound did not reveal any gauze. Yeah, and then there's no deep wound where gauze can be hidden. So the X-ray was done at the neck, chest, abdomen, pelvis, and leg, and repeat count was done as well. And then they also searched throughout the OT, tapi tak jumpa lah. Yeah. Anyway, the safe surgery checklist tu nampak ada complete documentation. Okay, so let's see what is happening actually. Okay, next one please. Okay, these are the contributing factors to the incident, yeah, based on the root cause analysis. Yeah, one is actually team factor, lack of communication between doctor and nurse regarding the use of the gauze before, during and after the procedure. They also didn't practice a shout out. Yeah, kalau kita tengok buku safe surgery guideline kita 2.0, we actually mention clearly about the importance of shout out. Yeah, so communication is very, very essential. Yeah. And then circulating nurse left the OR without replacement to get additional equipment. Yeah, so circulating nurse pun ada masa terpaksa pergi untuk cari barang yang tak cukup. Yeah. So kita ada short-handed dekat situ, and then all 5 doctors involved in the surgery asked for gauze and instrument at the same time. So the nurses, the scrub nurse and circulating nurse cannot cope. So maybe ada kesilapan juga berlaku di situlah. So in terms of individual factor, the surgeon need to take leadership in coordinating the surgery and improving the teamwork and communication. And the surgeon need to implement the checklist and guideline effectively. And the nurse need to speak out also to ask for help if she can. And then in terms of management and organizational factor, training was not done properly and comprehensive to all staff. And then no monitoring done on the implementation aspect of safe surgery program lah. Audit pun tak pernah dilakukan. And then dari segi task factor pun ada, iaitu surgery ni involve multiple surgery lah, and involve multiple discipline, more than one discipline. So these are some of the contributing factors that actually lead to the incident. Anyway, finally they cannot find anything lah. Finally pun tak jumpa, and then they they close everything. And until yang information kita dapat tu, so far nothing happened. Yeah, the patient did not experience any symptoms or anything lah. Hopefully maybe salah kira dan sebagainya lah. So hopefully it's not with the patient lah. Yeah. Okay, so next one please. Right, okay. Case study 7, close call. Yeah. At 8:48 a.m., there was a boy, yeah, underwent examination under GA of bilateral ears and bilateral meningotomy and right grommet incision and adenodectomy, yeah, and then everything completed, yeah, and the anesthetic is already confirmed with the scrub nurse on the removal of the throat bag lah, yeah, okay. So and then 10:20 pagi, patient was discharged to the daycare ward. Yeah, and then 10:50, patient was restless. Yeah, the boy was very restless and impending respiratory collapse. Yeah, so the patient was sent to OT for examination of oral cavity or pharynx under GA, and they finally found throat bag and removed. Yeah, the throat bag lah. Yeah. So nasib baik patient dapat diselamatkan lah. Yeah. Okay, so this is a close call lah. Yeah. Lucky we managed to do the damage control and alhamdulillah patient selamat. Okay, next one please. Case study 8, tajuk dia oh boy. Yeah. A 3-year-old boy had adenotonsillectomy, discharged on day 3 post-op. And then day 5 presented to A&E with cough, vomiting, blood-soaking cloth, yeah, vomiting blood and fever. Yeah, and then he was readmitted and treated as post-tonsillectomy bleed, and then discharged at day 7 post-op with antibiotics. Almost a month post-op, patient presented to ENT clinic with complaint of bilateral foul-smelling nasal discharge for about 3 weeks. Yeah, and then he went to see 2 GPs actually, yeah, and was given antibiotics, but nasal discharge persisted. Yeah, and then nasal endoscopy was done and then found blue-colored foreign body over left nasal cavity, but patient cannot tolerate further assessment. Yeah, so therefore they actually did the examination under GA, and then they found a tonsil strip 6-inch in the nasopharynx. Yeah, alhamdulillah dapat kita dapat mereka removekan, and then the patient recovered. Yeah, so this is another example of unintended routine surgical item lah. Next one please. Okay, case study 9, almost perfect. Yeah, this patient actually had cemented bipolar hemiarthroplasty of left femur. Yeah, and then the surgery went for 4 hours and everything went well lah until the end. Yeah, prior to the wound closure, the surgeon was confident that all the instruments were taken out already lah. Yeah, and then during the cleaning and counting of the instrument post-op, the implant rep actually noticed the femoral head trial was missing. Yeah, and then surgeon ni pun minta everyone semua cari, yeah, dekat OT but cannot found. Yeah, so they did X-ray and then found the femoral head trial was left inside the acetabulum, and then the next day they had to do another surgery to remove the retained femoral head trial. Yeah, so this is another example lah. Yeah, okay, next one. Right. So kalau kita tengok dekat sini, related to this case, yeah, the unintended retained femoral head trial was actually the symptoms or the signs that there are so many failure in the system. Yeah, pertama contohnya the implant rep forgot to recheck all those instruments before wound closure. The surgeon also did not double check, yeah, all the instrument used. Yeah, and then lack of communication between the surgeon and the implant rep regarding the instrument count before closing the wound, and the team member also did not speak out of any concern. Yeah, everybody just macam keep quiet saja. So I think macam orthopedic they actually their surgery deal with lots of instruments. Yeah, so they really need to be very careful, extra careful lah. Yeah. Okay, next one please. Okay, so how to prevent similar incident from happening? Yeah. So what can we do after an incident happen? Yeah. First of all, actually, please do not blame the staff. Yeah. Normally, if an incident happen, it's actually the failure of the system. Yeah. Kalau staff kita tak tahu, that means it's the failure of our organization to give adequate training to our staff. Yeah. So that's why it's very important to conduct the root cause analysis. Yeah. And based from my experience, sometimes when we do conduct root cause analysis, either the patient get the blame or our staff get the blame. Yeah. So when we conduct root cause analysis, it's not about trying to find who's to blame, but actually try to find where are the loopholes in our system so that we can improve. Yeah. And then we need to formulate effective risk reduction strategy. Yeah. For example, selalunya bila kita dah buat root cause analysis, kita punya action plan ialah give training saja. Training pada staff. Tapi itu saja tak memadai. Maybe we need to do extra thing, for example, not just training but regular audit. And then maybe mystery shopping, just observational audit, surprise observational audit to see, what is actually the practice of our staff. And then also dari segi leadership. Leadership is very important. So we must have someone to champion safe surgery program in the organization. So if the hospital director give emphasis on this, that should be the way lah. Together with the surgeon from each discipline lah. The head of a surgeon from each discipline. And then implement the action plan, and then we should monitor and approve accordingly. Okay, sebenarnya untuk di Malaysia ni kita sebenarnya tak ada berapa susah sangat lagi sebab kita dah keluarkan Safe Surgery, Safe Life guideline yang belakangan ni, the second edition, whereby we have improved so much, and we also put in other things like communication, leadership, and not site marking, not just the about the checklist. And also on your left, ada incident reporting and learning system guideline. This guideline I actually wrote myself in 2018, and actually all these are actually downloadable for free. Just Google Patient Safety Council Malaysia website. It will take you to the website, and then you can just download it for free. We do training untuk kita punya staff on root cause analysis, because sometimes bila you buat root cause analysis also sahaja is not sufficient. We also need effective risk reduction strategy, which is also important. So now our training, we actually teach you how to do root cause analysis as well as how to formulate effective risk reduction strategies, because no point lah kita asyik buat root cause analysis tapi dari segi tindakan tu tidak begitu efektif. So this is very, very important. And we need to monitor and improve accordingly lah. Okay, next one. Right, when I talk about system improvement, it's about a comprehensive approach of improving our healthcare system, sama ada dalam department kita atau dalam hospital kita. So it involves management and organizational factor, work and care environment, the task and technology, the team factor, and then the individual and staff factor and the patient factor. So we really need to look into all these to improve, in order for us to improve our system and to prevent a patient from being harmed. So what we want to do now is actually to prevent them. Okay. kalau kita tengok contoh-contoh yang saya bagi tadi is not really rocket science. It's very much about improving the system, kan? And we all need to work together for this lah. Yeah. So in summary, we can see that lack of leadership and teamwork, ineffective communication, ineffective use of safe surgery checklists are common contributing factors leading to the wrong surgery or unintended surgical item. Yeah. And then I want to emphasize again, root cause analysis, effective risk reduction strategies are essential to prevent a similar incident from happening. Yeah. And a safe surgery checklist is readily available tool to ensure the surgical safety. It's just that staff need to be trained properly, not just about the use, not just about the use of the checklist, but also the important process, critical process like time out and then shout out, yeah. Dan juga about that safety thinking and safe practice. Yeah. Why is very, very important. Yeah. Kadang-kadang kita silap sikit je can lead to really severe harm to our patient. Yeah. So last but not least, I want to emphasize again that each and every one of us is very important, and we all play a very crucial role in preventing a patient harm. Yeah, and all of us can make a difference. We need everyone, yeah, each and every one of us to work together to improve patient safety and prevent patient harm. That's all. Thank you. I pass the session back to the moderator.
Thank you again, Dr. Nur Aisyah, for the informative and interesting talk. I was informed that Dr. Aisyah is in hurry for another meeting around 3:30. Are you still available until 3:30, Dr. Aisyah?
Maybe if there's a few, a few questions, I probably can try to answer.
Okay. There's few questions asked. One is about taking the consent. I mean, to avoid all this, error and also wrong side. Is it best to be taken in a clinic setting or in the ward, or it should be done in the OT itself?
I think the current practice, it can be done in the ward, in the clinic, kan. But I think the most important thing when we see that all these incidents happen and wrong surgery happen, is not about issue consent to sendiri, but it's about the process of checking, yeah. Checking macam and verify with a few other source. I think itu dia punya important message, yeah, because consent ni pun, I mean, when we want to take consent, when we talk about informed consent, meaning we need to give consent. Before we give consent, we need to explain, kan? We need to explain to the patient, or if it involves children, we need to explain not just to the children as a patient, but also to the waris, kan, ataupun penjaga, ya. So the process kadang-kadang mengambil masa yang agak panjang, so that's why I think kadang-kadang kita buat benda tu beforehand lah, before the surgery, But I think the most important thing is checking. Sebenarnya dah banyak proses. Kalau kita tengok safe surgery punya proses ni dalam kita punya garis panduan dan dalam kita punya checklist tu, sebenarnya ada banyak sekali proses-proses checking. Tapi macam mana boleh jadi sebab benda betul-betul check. Kadang-kadang kita tick sahaja, kadang-kadang kita tulis tapi kita nampak, kita gunung-gunung baca tapi kita tak attentively absorb. One, because maybe kita pun dah fatigue, we have been maybe working long day. That's why checking cannot be done by one person. We need to do it, a few people need to do it because we are just human, kan? So that's why the checking is important, and also it need to be done by a few people lah, just to avoid that mistake lah. Yep. Okay.
Dr. Aisyah, another few questions. I mean, if you read the news internationally, we do listen or we do read cases which happen in India or even in Russia, but we seldomly read this kind of incident happen in a well-developed country. So how does this safe surgery, safe life implementation impact in the developed and developing countries differently?
Actually sebenarnya developed countries pun ada banyak juga isu-isu medical legal related to all these medical unsafe surgery, wrong surgery or unintended routine surgical item. Memang ada lah, because so I think what we want to do now is actually to improve the system. That's why I personally believe in safe surgery program and checklist, because we have a tool to actually assist us, so that all these checklists can actually help us rather than just rely on our brain. Ada satu checklist yang boleh membantu kita untuk kita check the important critical process. Jadi kita tak adalah terbeban nak ingat apa semua kan. So kita boleh tengok pada setiap proses ni dan dia membantu kita untuk memastikan okey ni selamat, ini betul, ini betul, ini betul, ini betul. So it's the same. I mean either developed country or developing countries or low middle income countries, when we talk about patient harm is the same. It's happened everywhere, so we really need to give priority to it.
Okay, maybe our last question for Dr. Aisha. I mean, after all the cases that we heard before from your presentation, 38 cases from 2013 to 2021. I mean, this is a real case. This is our father, our mother, our parents, our children. After the implementation of SSL and all the enforcement of the safe surgery program, are we going towards improvement? Is it the cases is reducing or is actually getting worse?
I think when we look at the unintended routine surgical item tu, kalau kita tengok dia memang it's increasing definitely significantly, but we feel that maybe because many people start to report more, including the category 1 lah, so that's why we actually refine the definition and we actually said okay, our target is 0 case for category 2 and 3 retained surgical item. Sebenarnya kalau kita tengok kita punya wrong surgery lah cases, kita ada 38 untuk daripada 2013 sampai 2020. Nak kata banyak tu, saya rasa sebenarnya adalah orang yang tak report lagi. Untuk pengetahuan semua, Malaysian Patient Safety Goal, we actually rely very much on the healthcare organisation to report to us. Jadi kalau orang tak report, memang kita tak tahulah. At the moment, we don't have that capacity to actually go and audit dan sebagainya. So we actually rely on face value. But I think actually probably I think there are more cases that are not being reported. And hopefully with the with more people knowing more about patient safety, then they realize that reporting is not about blaming, it's all about improving the system, learning and improving the system.
Okay, thank you again, Dr. Aisha, for the answer of all of the questions. We don't want to delay you for your next meeting. Thank you again for your very interesting presentation. Enlighten us about the real burden of wrong surgery, the real burden of instrument retained in patient body. So by then, we finish our symposium for today. And then thank you again for the audience for the active participation. Hopefully this presentation will be beneficial for all of us. Thank you again for your attention. I then pass back the microphone to our chairperson, Dr. Ikhwan. Assalamualaikum warahmatullahi.
I just want to add, if someone is interested to know more about incident reporting, root cause analysis, we do have our presentation in our website, so you can use it for the purpose of education, learning, and share with others also. And if anyone interested to know more about root cause analysis, risk reduction strategies, I'm more than happy to help UIA as well. I mean, we are together in this healthcare organization, so we can help in terms of doing a proper root cause analysis. Yeah. Okay, that's all. Thank you. Thank you so much for inviting me.
Okay. So, okay, Kwan, your mic is yours.
Thank you, Dr. Narisha, and thank you, Dr. Irfan, for the lovely talk this evening. Well, it seems that we have reaching the end of our symposium. We have gone through quite a number of series, quite a number of talks, and some of the important points made was safe surgery do actually save lives, because the complications were rather devastating, can be devastating. And it's just a matter of making a culture, a safe culture among ourselves as well as our colleagues. Okay, thank you, Dr. Narisha.
So is it CPD?
For your information, this symposium is also brought to you by Umi Medical Appliances. And we would like to share a video which was prepared by the sponsor as well. Do spend 5 minutes of your time to actually see and watch the video. Ladies and gentlemen, I thank you very much for your active participation throughout this symposium. A friendly remark: do not forget to claim your CPD point from the registration link provided in the chat box, and the e-certificates shall be awarded through your email based on the attendance, the sessions attended. But before that, we are pleased to have our General and Hepatobiliary Consultant, Associate Prof. Junaini bin Kasian, to deliver his closing remark. Prof, the mic is yours.
Assalamualaikum. Can you hear me? Boleh dengar?
Waalaikumsalam.
Okay, thank you. Assalamualaikum and good evening, good afternoon rather. Thank you, Ikhwan and Mr. Chairman for today, ladies and gentlemen. I think we have reached the end of this edition of East Coast Surgical Symposium. This time we have the theme of Safe Surgery, Safe Life. And I think I'm here today as a last minute replacement for the Dean. Due to technical reason, our Dean is supposed to give this closing remark. Is not able to give his remark today. So boleh Iwan sebagai ini super sub lah kata dalam bola tu ya.
It's an honor, Prof.
Okay. I think you all agree with me that this symposium or webinar rather has been an outstanding and have reached its all goal and objective, I think. Myself, I think from my behalf, I think I have learned a lot from all the series of talks that was given over the period of the last 3 weeks. So again, for the last 3 weeks or 3 Mondays, afternoon, which is very difficult part of the day to concentrate. Our mind has been assailed or rain or even storm by ideas, example, information, facts, reminders, interpretation and vision of safe surgery, safe life. And it will probably a day or two for us to digest them all together, to consolidate what we have learned from here on our own personal perspective. Indeed, plenty to reflect upon, and if this is any way enhance our individual and collective contribution to meet the SS surgical safe surgery, safe life ideas and challenge. I think the challenge remain that of to properly and diligently practice this concept of SSL. Has been there for some time, and I think we are practicing this. But I think, as our chairman mentioned here, to put this as a culture in our setup and practice. So I, on the behalf of the Department of Surgery for Kuliah of Medicine and also Sultan Ahmad Shah Medical Center, SASMEC, would like to thank all the speakers, external speakers. We have, I think, 2 external speakers, all the panels and members from the internal speakers. I think this is special thanks to Dr. Nuraisha Abu Bakar from KKM, our last speaker. I think I was told that she have been involved from the very beginning and planning of this portion. Thank you, Dr. Nuraisha. I think without their presence and presentation has been invaluable, and without any doubt has helped make this event a great success. Okay, we greatly appreciate the support that we receive from SASMEC in helping us setting up this symposium, and also I think majority of the staff from SASMEC and also from the Kuliah of Medicine help us in setting up this symposium this time. Also, special thanks to Umi Surgical, Stroke Carl Stores, I think for their sponsorship for this event. I think it is not it's not fair if we don't mention the audience. I think we are also grateful to all the audience who have been listening to all the talks for the last 3 Mondays. Without all of you, this symposium won't be a success. And I was told that there are about more than 200 participants involved, I think, on Monday and previous Monday, the last 3 Monday attending this symposium. Again, 300
Actually 400, 450.
400. 450. Okay. Sorry. Okay. So lastly, I would like to congratulate the organizing committee. I think to name that too many of them, there are too many of them that to name them individually, but I think I have to name one, but under the leadership of Associate Professor Dr. Muhammad Sarif, as well as all members of Secretariat staff who spend time and effort to see this seminar through. Well done, everybody, and congratulations. So since, as you know, I think a lot of you know that the East Coast Surgical Symposium is supposed to be an annual event. So we look forward to seeing you again next year, probably with different team, and hopefully it's a normal event, face-to-face event. So
Inshallah.
thank you very much. That's all.
Thank you very much, Prof. Junaini, for the closing remarks. Well, it's really hard to say goodbye for this session, but before we go, please provide your feedback through the feedback forms in the chat box provided. And with that, we will end this East Coast Surgical Symposium for this year. Inshallah, we will meet again next year. Assalamualaikum. Well, it seems everyone is still here. Why don't we have a photo session before we end 2021 East Coast Surgical Symposium? May I invite everyone to switch on their camera for a screenshot? All right, thank you everyone for your active participation. It's been an honor to chair this year's Surgical Symposium. Hopefully we'll meet again next year. With that, I thank everyone. Assalamualaikum.